Hello everyone. Today, we're diving into system-based strategies for managing chronic diseases. Our objectives are to demonstrate effective public healthcare coordination methods and develop targeted promotion strategies.
Let's get started. Chronic diseases affect so many people. What exactly are chronic diseases?
Chronic diseases are long-term health conditions that can be controlled but not cured. They include diabetes, cardiovascular diseases, and respiratory conditions.
Why do we need a system-based approach for these diseases?
It helps us understand how different parts of the health system interact to provide comprehensive care.
Who are the key stakeholders we should involve?
We should strive to include healthcare providers, community organizations, patients, and policymakers. Their input is crucial for developing relevant strategies.
What are some of the methods can we use to coordinate care effectively? Why is this so important?
Shared electronic health records are essential, allowing providers to access patient information quickly, and regular communication among team members is key for continuity of care.
We need to develop some system-specific public health promotion strategies. Where do we begin?
First, we should assess the community's needs using surveys and health data.
How do we ensure we're addressing high-risk populations?
Utilize data to identify groups most affected by chronic diseases, such as low-income families or those in rural areas. What do you think might be some good examples of evidence-based interventions?
Programs like the Diabetes Prevention Program, which emphasizes lifestyle changes to prevent diabetes. Technology plays a significant role, right?
Absolutely. Telehealth expands access to care, especially for those with mobility issues or living in remote areas. How do you think we might measure the effectiveness of our strategies?
We could measure effectiveness by tracking health outcomes and patient satisfaction through surveys and data analysis.
What are some effective community engagement strategies that we should consider? What are your ideas?
I think it would be a good strategy to begin hosting health fairs, workshops, and using social media platforms to reach a broader audience.
Those are all great suggestions. But what barriers would we face in managing chronic diseases?
Some of the current barriers are transportation, language, and cultural differences that can prevent access to care. How can we partner with local organizations?
Collaborating with nonprofit entities can enhance our resources and support community initiatives.
For example, recently we collaborated with a local clinic to reduce hospital readmissions for heart failure patients by designing and implementing a structured follow-up program.
This is a great approach. What future strategies should we adopt for chronic disease management?
We would also want to think about integrating holistic approaches and include mental health services alongside physical health.
This has been an excellent conversation. I appreciate your feedback.
I am always happy to help. Thanks for joining our conversation.
Thanks, and keep working on your community initiatives.